Hi, my name is Tammy Kazanaja. This is my student ID.
This is the patient script. We're going to do a quick 360 of the room.
The patient's vital signs are abnormal with tachycardia and hypertension. Temperature and respiratory are normal. This is due to the chest pain the patient's having and epigastric pain and past medical history of hypertension. I'll be asking you some questions. Do you have any shortness of breath?
I don't think so.
Any chest pain?
I have an ache in my upper chest.
Any abdominal pain?
I have a stomach ache.
Any palpitation?
No.
Any nausea, vomiting?
I feel nauseous and I did vomit once.
Any dizziness, vertigo?
I feel just tired.
Do you drink alcohol?
I have a glass of wine during dinner sometimes.
How's your bowel movement?
Normal.
Okay, I'll be doing a full pain assessment, but the purpose of the video, I won't be doing it. I will now be inspecting your heart sound, your cardio. Patient is alert oriented ×4, no jugular vein distension, no swelling. Worker breathing is normal. Behavior, no dyspnea on talking. Behavior is normal. No pulsations and no cyanosis noted. Now I'll be listening with the diaphragm of my stethoscope to your heart sounds for a full minute each. Aortic, pulmonic, herbs, tricuspid, mitral. This is to hear any abnormal sounds like murmur and brutes. Now with the bell, I will be listening for a full minute. Aortic, pulmonic, herbs, tricuspid, mitral valve. To hear for any abnormal sounds like swishing swishing or whooshing, that's murmur, that would indicate turbulent blood flow. I would listen for the apical pulse for a full minute, which is at the mitral valve. For any heart irregularities or pulse deficit, I would check apical and radial at the same time. Now I'll be palpating your carotid pulses, radial, brachial, dorsalis pedis, and capillary refill, which is less than 3 seconds. Pulses are equal and strong bilaterally. Now can you lay down? I will do a GI assessment. Patient's abdomen, no bruising, no pallor, no lesions, symmetrical, contour is normal, no rashes or no scars noted. Now I'll be auscultating your abdominal sound starting from right lower quadrant, which is the appendix, for a full minute going clockwise. Right upper quadrant, which is liver and gallbladder. Left upper quadrant, which is stomach and spleen. Left lower quadrant, which is the descending colon. Now I'll be percussing the abdomen starting from left lower to hear any abnormal sounds. Starting from left lower going clockwise because patient has pain on the upper side. Sounds like tympani that are heard in the stomach and the intestine or hollow organs would be heard, and dull sounds which are heard in the solid organs like liver and intestine. Now I'll be palpating the abdomen using 3 to 4 fingers in 1 to 2 centimeter depth, starting from the left lower going clockwise, regardless of the pain, in circular motion. Do you have any pain?
Just at the upper portion.
Okay, now for the SBAR, patient is admitted to the ER, 63-year-old with epigastric pain and upper abdominal pain, rates 8 out of 10. Chest pain, moderate chest pain that rates to the shoulder, that rates 5 out of 10. Nausea, vomiting, and appears fatigue. If a patient has a history of osteoarthritis, hypertension, hyperlipidemia, and diabetes type 2, and a family history of MI. Vitals are abnormal tachycardia and abnormal blood pressure, which is hypertensive. Patient inspection has epigastric tenderness and moderate chest pain. I would be expecting blood work, cardiac blood work, ECG, pain management, and further assessment from the MD. Now, as nursing, I think the patient has cardiac event happening like MI or angina, which is due to the past medical history of the hypertension and family history of MI. Also, I would be monitoring as interventions. I would provide pain management and monitoring vitals like heart rate and blood pressure, and expect ECG and troponin and cardiac enzymes from the MD.